we've invited, I'm just going to go through and introduce our panel tonight, and then we'll get into the questions here. The first panelist is Wizipan Little Elk, who is the Chief Executive Officer of REDCO, the Rosebud Economic Development Corporation. Prior to his position as CEO of REDCO, Wizi worked at the Department of the Interior, so we had a lot of experience working with Wizi in the early days of the Native Alliance. And want to welcome him to the panel. Our second panelist is Charles Cuny. Charles is an enrolled citizen of the Oglala Lakota Nation and is also the superintendent at Little Wound School, which is actually one of the largest tribal contract schools in the country. And we're excited for Charles to be on the call tonight. Little Wound is also one of our strongest placement areas for Teach for America. So yeah, he's been working with Teach for America for a few years now in that position as the leader at Little Wound School. Our next panelist is Andy Nez. Andy is the Senior Education Specialist for the Office of Educational Research and Statistics at the Department of Diné Education. And Andy's also, I believe, a 2016 Teach for America Corps member who served on the Navajo Nation within with the New Mexico region of Teach for America, where he taught Diné language and culture. So welcome, Andy. We're excited to hear your perspective of your nation down in Arizona and New Mexico. And also, we have Red Dawn Foster, who's an enrolled citizen of the Oglala Lakota Nation. And Red Dawn is one of our elected representatives. She serves as South Dakota State Senator for District 27, which encompasses primarily the Pine Ridge Indian Reservation and some adjacent counties within that area. And also, we really want to thank Red Dawn, who also attended our Native Alliance Corps Member Alumni Summit in Minneapolis, where she sat on a panel with an incredible group of elected leaders from North Dakota, Minnesota, and South Dakota. So welcome, Red Dawn. We're excited for you to join us tonight. We're going to be doing the panel discussion with several different moderators tonight. Here's a picture of our advisory council who have been working really hard in their respective communities and job and service that they're doing. So want to welcome them to the call tonight. And thank you for being able to participate in this discussion on the impact of COVID-19 on our Native communities throughout the United States in Indian country. Our first is Amina. Amina, are you on the call?
Yes, I'm here.
So I'm going to go ahead and turn it. We have Amina Foley Garza as one of our moderators. Brian Billy, who is Senior Managing Director of Teacher Leadership Development down in Alabama region. We also have Chelsea Wilson, who serves as the Chief of Staff for the Oklahoma City region. We have Kate Siltuska, who serves as a special education teacher within the Oklahoma City's school district, but she also is one of the founding board members of the Sovereign Community Schools in Oklahoma City. And we also have Shantae Jones, who is just a recent Teach for America alumnus who served 2 years in the Hawaii region and is currently residing on her home community and reservation on the Pine Ridge Indian Reservation. So without further ado, welcome panel, welcome everybody to the call. And I'm gonna go ahead and turn it over to Amina for the first question tonight.
Hi, everybody. glad that you all are here, and thank you panelists for coming and sharing some wisdom and some insight from your area of the world in Indian country. So glad that you're here. So my first question is for Andy. Hi, Andy, how are you doing?
Hello, I'm doing good.
Okay, hi. So I guess my first question is, how are things going on the Navajo Reservation in terms of, I guess, the concerns that I hear, especially even from my family who are there, are just concerns about our elders and how they're doing during this pandemic when so many of them are not able to get out and about, but need to.
Well, my name is Andy. Good afternoon or good evening, everybody. So her question regarding the Navajo Reservation and what is currently happening, as many of you probably know, we've made national and global headlines regarding the mass number of individuals who've been getting those positive results across the Navajo Nation. And this is something that started in early April, and it's just expanded to where we had the highest rate per capita of any of the states here in the United States. And so that was concerning. And so today, right now, we did have multiple restrictions at the local level and within our tribal government for the last, I actually counted it earlier, 94 days. So we've been kind of on a lockdown since the latter part of March and more strict towards the beginning of April. And it is true, we do have still a high number of cases that are still coming in, except recently within the last week, we've got down to double-digit figures where we kind of remained stagnant at triple-digit numbers, and that's just been very heartbreaking. A lot of the 60 and over are the ones who've been, lost their lives to COVID, and many of them, unfortunately, are elders. And of course, when we think about elders, we don't just think of a person, we think of their spiritual, we think of their medicine, we think of the many teachings that they possess in the language. And as Robert had mentioned in my introduction, I did teach Dene language and culture, which is I'm very passionate about. And, seeing just the number of elders who are going, it's just kind of, it's sending a really big message to our tribe and to our people that language is definitely going to be at a decline a year from today. And those of us who speak it really need to be able to speak it more frequently, despite the audience. And so currently, there have been 3,277 recoveries. As of yesterday, there was 39 new cases, totaling 6,672 cases since March 17th, which is the day we received our first case. And yesterday there was 8 more deaths, and unfortunately that's total 319, which is larger than many of our communities across the Navajo Nation. And over 45,000 have been tested. So there are some good and bad to all of this, and many of that, of course, goes along with our discussions. So we're doing well. Just yesterday, the Navajo Nation president issued a executive order to lock down the Navajo Nation again for 57 hours. And this is due to the spike that occurred in Arizona. As you all know, Arizona did open its state, and Governor Ducey does not allow, or it's not a recommendation for masks to be worn in the state of Arizona, which of course is concerning considering the Navajo Nation takes up about 25% of the state of Arizona. And many of our families and relatives are in Phoenix, so many of them do come to the Navajo Nation to check on their own families. We also have individuals who go out to see them. So it's still, something difficult to grasp every day. There's something new that we learned, areas that are affected. And the Navajo Nation is comprised of 110 chapters, which are like local governance centers across the Navajo Nations. And each week we get a new community that's a hotspot. So, it's still, we have to be very meticulous in what we decide to do and how we decide to go about our day every day. But there's a lot of restrictions still to this day. Many stores close early. There's curfew at 8 o'clock every day, every evening. It opens up back up at 5. So it's a whole lot of different emotions, both good and bad. But that's on the good part, we're doing fine.
Thank you for the update, because I know that that's a changing reality every day, and I guess another follow-up question I have, because that was directed towards elders, which is always a concern among tribes, right, as our elders, and just all the things that they have and that they keep for us. But the other question I have for you, Andy, too, is in terms of education, how has this affected, I know the last few months across the nation, we've been doing online learning with students, and I'm just wondering how that has affected our students on the Navajo Reservation, when it's already an issue prior to this, just getting broadband or having access, and how you think it's going to affect them as we go into the fall if this continues.
So here on the reservation, we're most certain that this will continue. Many of our grant schools here on the Navajo Nation start in the latter part of July. So it's no longer mid-August anymore. We're starting to get into July. And that's just a month away. And so last week or 2 weeks ago, I was appointed to be part of the reopening committee within our department. And of course, this has many factors that we're focusing on for, in particular, leaders, teachers, students, and communities and families. And so within these 4 different areas, we've branched out into the important things that we have to consider with schools that are reopening. And the Navajo Nation is comprised of over 225 schools, and that includes public, grant, BIE, parochial, charter, and over 80,000 students. So we're very large, and we're very fortunate to be educating many of our students. However, when we talk about reopening schools, that's something to consider is definitely technology. Many of our communities are small. Many of them are very isolated and very rural. And so bandwidth is not able to support a lot of those students who come from those areas. And not only students, but staff as well. There are parents and teachers who depend on cell service, which unfortunately is not the very best sometimes due to our terrain here. Although we have the most beautiful land in, among the many tribes across the country, but that kind of has an effect when you're talking about technology and those resources that could benefit our students. And I've been conducting some small research here and there and helping our technology department in addressing those concerns because, like I said, that's a huge problem. And New Mexico Public Education Department, as well as Arizona Department of Education, have been gracious and have donated thousands of supplies and devices, Chromebooks, Wi-Fi, hotspot services to the Navajo Nation. And so, for us to consider a very large area and over 3 states, we have to deal with 3 different agencies, 3 different departments, 3 different governors. And, many of these, especially in New Mexico, are considered checkerboard. So a lot of it is tribal land, some of it are private, some of them are state, and this can just be in a range of 10 acres. So there's, situations like that we have to deal with. But there are 4 areas that we are considering for reopening schools, and we're leaving it at the school level to develop what is best for them, because we, some of us don't come from certain regions on the Navajo Nation, so therefore we can't really make the decisions for them because we don't know their local demographics that will best be suited for them. However, this roadmap that we're creating is going to guide them to make sure that they're considering the utmost respectable situations, scenarios, and of course, keeping aligned with the CDC guidelines.
That's a lot. It's a lot to take, and that's a big responsibility that you're dealing with.
Yeah.
Thank you so much for sharing that. It's just the insight that you have is just so much different than what we don't get if we're not there, we're not listening or knowing this. But thank you so much for sharing that, Andy.
Yeah, you're welcome.
Maybe we could also hear from Wizipan on, can you share any demographic information about here in South Dakota, Rosebud Reservation, and response to the pandemic? What did it initially look like, and how is it now?
Thanks. So if I don't know the latest statistics as of today, but we have probably about around 45 or so cases. That is total cases, so it also includes a number of folks who've recovered. To our knowledge, we don't have any deaths due to COVID. However, we do have I think the one of the issues is we do have a much lower testing rate per capita. So I think one of the important things that folks, when we're like comparing, different areas is, like Navajo, for example, they may have a lot of cases, but they also have a really high testing rate, which is good and a testament to their ability to respond. So that, I think that's one issue. I think, in general, some of the, Rosebud and so the other reservations have done a pretty decent job, and it's because of their ability to implement in social distancing measures and to do it in a way that's much more stricter than some of the states. And you have to combine good science, good medicine, along with like really strong public policy. But it really has disrupted a lot of folks' daily routines, because we do have curfew. In Rosebud, we do have curfews. In the beginning, it was 6 a.m. to 10 p.m. It's now been extended 2 hours until midnight. But it really has disrupted a lot of people's routines, and is beginning, I think, from a social perspective, to put pressure on folks. I don't know if it's directly related, but we have had 3 murders in the last month here in Rosebud. But I think that kind of speaks generally to kind of the pent-up energy and kind of and we're seeing that play out nationally in terms of social unrest. And I also think that it's really highlighting some of the pervasive and persistent inequities in communities. And maybe we can talk about that more later, but kind of as a quick snapshot, just kind of from Rosebud. And I think one other thing I think is real important is, again, the impact to students, and I think how unprepared we were as kind of school administrators. I sit on the St. Francis Indian School Board. I'm filling a term until August, and it really did catch us off guard. We just weren't prepared. So we have a long way to go, but one thing about making mistakes is you get to really learn. You really get to learn. So hopefully you don't make them again.
Thank you so much. Our next question is to Red Dawn, who is our state senator, District 27. I know in the news, we've been making a lot of news from South Dakota recently with the dispute between the state and our tribes and sovereign nation. What were some procedures, such as the curfew checkpoints and closures? Why were they necessary, and were they effective? And can you give us a little bit of the background in your perspective as working within the state government? Red Dawn, are you on mute?
I am, thank you.
Okay.
So yes, it's definitely been an interesting process working between the state and the tribes, working in a super Republican majority. The state's never taken a shelter in place provisions. So it was really up to the tribes to make sure that their vulnerable population was safe. And so when we instituted the checkpoints, it was, one, to monitor the traffic that was coming in and out. Because South Dakota had never been in shelter in place, we saw a lot of tourists from other states. And so around the surrounding reservation areas, a lot of the hotels were completely booked. The camping lodges were full. and you would see parking in the parking lot. You would see license plates from New York, New Jersey, Colorado, New Mexico, all over different hotspots there. So the tribe felt that it was necessary to put up the checkpoints, to monitor the traffic that's coming in and out, and then also to be a form of reminding, marketing, of saying, you know, right now is a time to be extra vigilant. As you're leaving the res, make sure that it's with purpose and you're taking certain precautions because of our underlying vulnerabilities, the population, and just our healthcare system isn't designed to accommodate a huge spike in COVID cases. So I think that it's been definitely, from a practical standpoint within the tribe, been effective. In the state of South Dakota, we have 5,742 confirmed cases with 4,755 cases recovered and 74 deaths. And in my district, for the Pine Ridge area, Ogallala, Lakota County, we have 25, but we've been doing mass testing. So we expect this number to increase. But I think that it's definitely been effective in both slowing the traffic coming in and off the reservation, but also being a reminder that mask up. This is for our relatives. When you're leaving the reservation, come back and be extra vigilant. And where the state, through that process, has taken a different stance. I mean, as you know, they're challenging the checkpoints and illegitimately, I might add. So that's been an interesting process as well.
Thank you so much. That was really helpful to understand. I wanted to ask Andy, I'm sorry if I've got kiddos that pop in. So what's the impact been to direct services like the judicial services, education services, and food distribution?
Hi, Chelsea. So regarding the services that the Navajo Nation, on March 13th, the Navajo Nation president issued an executive order, a stay-at-home order for its employees, and there are over 6,000 Navajo Nation employees spanned across 3 states. And within these areas, we have our own guidelines as well. And we also get penalized if we do things that we're not supposed to or travel where we're not supposed to. And so many of the departments and offices are closed. That includes the judicial, executive, those that provide direct services, although there are a number of quote unquote essential employees who have to maintain their services because they also have their federal guidelines like social services or students on meals as well, which each school district and each grant school have been monitoring and providing those meals for students under the age of 18. And so many of these cases, I know this has been problematic in some areas because, you have families and individuals who need to go and get court cases completed or anything related to the judicial branch. Many of their employees, again, like I said, are it's just limited across offices. Like currently the Department of Education, we operate on over 70 employees, but recently there's been an exposure in our building. So we've been closed for 2 weeks and, just working through telecommunications and providing those services to schools. And, we just try to do our best to use technology to its advantage. And we've been receiving thousands and thousands of donations from other tribes within our states as well. It's just like, it's been growing massively, and the president's administration has been very vigilant in getting that to our communities, and he's reached, I think, all 110 communities. And so many of them are seeing president's office for the second time. And, they're just providing all types of services. We also have our own Navajo Nation enterprises, housing. We have our utility company. We have gas companies who are also providing free services specifically to 60-year and older residents. That's kind of their priority at the moment. And then everyone just kind of gets in line after. But in terms of the programs and offices, that it's just everyone's doing the best that they can on limited employees. And each time that the Navajo Nation schedules a date for reopen, it seems that just the number of cases that we're receiving just pushes it more further. So like right now, we're scheduled to reopen with the Navajo Nation on July 6th. But you know, when we get closer to that date, it may be pushed back to another 3-4 weeks. So that's just kind of how everything is operating. So everyone's doing the best that they can.
Yeah, I'd love to kind of ask the same question to our other panelists. If your communities are facing any interruptions in direct services.
Maybe Charles, you want to go? You haven't spoken yet.
Sure. Good evening. My name is Charles Cuny. I'm the superintendent at Little Wound School, Pine Ridge Indian Reservation, southwestern South Dakota. In terms of direct services, you know, I think the one thing with western South Dakota is, in the Pine Ridge Indian Reservation, is there's a real contradiction in terms of we shut down school March 12th, you know, went into a full-fledged lockdown. And I want to say the cases have started to rise on our reservation here in the last, 3 weeks. I want to say we're close to, I don't have the latest stats, but I feel like I was told it was around 50 cases at the beginning of this week. And so I think the real contradiction in western South Dakota is, like Red Dawn mentioned, it's a red-dominated state, and Native Americans really don't have a voice in terms of state government, local government, and tribal government's really taken the lead in terms of putting the restrictions down, and how that relates to the administration of our school is, we really look at the CDC's recommendations, we look at the state of South Dakota's recommendations, we look at BIE's recommendations for reopening, and ultimately that comes down to the local school board, the health and safety of getting our students back in school. But I think, Little Wound School has about 210 staff members. I want to say we probably have 50 staff members that are above 60 years old. In terms of Wi-Fi access, we had some challenges in terms of, we adopted 6th through 12th grade that we bought them iPhone 7s and paid their data plans. We have contingency plans in place going into next year that will utilize some CARES funding to provide that Wi-Fi access. But in our planning meetings here in the last month, we've really, we know how to go back to school and operate traditionally, how that looks. So that's not really a hard plan to put into effect. But the real plan is, the challenges are getting our students connected. I think the physical aspect of getting them devices is one thing. The actual challenge of getting them to participate, having them reach learning goals, that's the real challenge. So those types of challenges, we have the foundation, we have the network in place to move forward, whether it's a semester of additional online learning, whether it's an additional year, whether it's a hybrid system where we bring K through 3rd graders in for a week, cycle out another group of students for another week. I think in terms of the social economic structure of the Pine Ridge Indian Reservation, is the schools are really the lifeblood in terms of getting students fed. Between March and the end of the school year, 3rd week of May, I want to say we delivered close to 60,000 breakfasts and lunches. So that was one aspect that the schools picked up, that social welfare aspect of making sure students are fed. But the mental health aspect of it, I think it has an effect on everybody. I think everybody feels a level of pressure. We were fortunate enough to have a SAMHSA grant have a really progressive young counseling staff that has utilized Google Hangouts, is able to reach out to students, been able to provide, some support to our staff members. But moving forward, I really anticipate in South Dakota that the cases are going to go up. The policymakers are really saying, open up the gates. It's tourist season. And I think indirectly, reservations will feel the effect of that, just because at some point in time, everybody has to travel off the reservation, get groceries, come back. And so I just see the spread of the virus increasing, and some real challenges. And I think the other side of the coin is the equity aspect of, are we able to provide our students with the tools they need to be successful? And I would say online learning is not ideal. There's a lot of challenges. Even if a student's connected, they may be living in a home with 10 or 15 people. They may not have the environment. They may not have the support to be engaged online. So all those challenges come into focus. But I think there's a point where you have to take a couple steps back and just realize that we're all going through this, and we have to have realistic expectations. And that's kind of my theme in terms of communication with my school board, my staff, and our teaching staff. Thank you.
Yeah, thank you so much for being here, Charles. Your answer just segues perfectly to a question that I know my colleague Kate has. So I was going to pitch it to Kate.
Thank you so much, Chelsea, and thank you so much to all of our esteemed panelists for taking the time out of your day when there's just so much going on. I just wanted to be sure to thank you for being here with us today. Charles, you were talking about the virtual learning plan and how difficult it is for students to have access, which is something we've been experiencing here in Oklahoma as well. And I really appreciated how you talked about the inequity of online learning, because even if a student does have internet access, sometimes they're, like you said, one of 15 people in the home, or they don't have the support to really utilize the tools that they're being given. And you discussed realistic expectations, and I was wondering what that means for your community in regards to like wellness and well-being. Because I know some people are taking distance learning and they're making it really rigorous, and a lot of kids are falling behind, the kids without access. And I'm just curious about the implementations for wellness and the realistic expectations that your community has for its kids.
We had a planning meeting yesterday, and I think we kind of had some scenarios of, more than likely we'll probably move into the first quarter of the school year in some sort of online hybrid system. So within that construct, you have to be able to, we have about 900 students, we have 200 staff members, and we have probably an operating budget of $14 million a year. So we have a lot of resources to go out and reach those students. It's just, one challenge for me is changing the mindset of our administration, teachers, and support staff to say, you know what, this next year, we're all going to have to step out of our comfort zone. Some of you may be student age, you may be on the bus taking temperatures, you may be helping with delivery of food, you may be meeting individually with a student and helping them with some math or science. So those types of plans are in place. But what I envision is, an online system. We have some surveys going out to our students, our parents, and our staff members in terms of just trying to gain where they're at, what they're comfortable with. Because a big question we have is, as a parent, how comfortable are you sending your kid back to school? The other side of that coin is, in our environment, a lot of our younger kids are being raised by grandparents. So, with COVID-19, susceptibility of the elderly, that creates some scenarios where we want to find out where the community stands And ultimately keeping those doors of communication open with our local tribal members, with the education committee and the Oglala Sioux Tribal Council, because ultimately they're going to set the resolutions that are going to allow us to operate in one form or another. And so those types of things have to be in place. But the other side of it is, I think kids want to get out there. I mean, one thing I think about is student activities, sports, cross-country, football, basketball, all those things. The state of South Dakota seems to be moving forward with those, but the regulations and the resolutions on the reservation don't allow for those types of activities yet. And I just think as we move through COVID-19, we learn how to protect ourselves. We get over the mental challenges and PPEs in place, and there's adequate testing, and we have protocols for contact tracing. I think even internally, we're developing our COVID-19 personnel policies. And as that stuff evolves, I think we're going to be in position to gradually move forward. But I also think, we're living in two different worlds in South Dakota. There's a lot of mixed messages, but I really appreciate our council. Sometimes tribal council can be a group of characters at times, but I think they've made some decisions that were based on the health and safety of the entire nation. So I hope that answers a little bit of your question.
Absolutely. Thank you so much for taking the time to share with us about just how much communication is required to really understand the perceived vulnerabilities within a community, because I think a lot of people take for granted that people will just develop the answers without really seeking from within the community. So I appreciate your perspective. Thank you so much.
Yes. The next question that we had as an alliance, I would love to hear from Red Dawn or Wizipan just a little bit. I know, like for my tribe specifically, I mentioned in the chat a conference that we have annually for our community and cultural organizations across the country. Initially, I was going to do some trainings and provide some content around leadership and nonprofit management, but now they're asking if I have any expertise around COVID-19, just because of stimulus funding and the CARES Act package. And so I know they received some, but I think that for a lot of tribes, my tribe included, it's a little bit intimidating when we think about how we're going to report sending these funds. So I was just going to ask how that's going in your community, if you have any advice for other tribes, and how tribal financial officers can step into communication so that we all remain compliant and it doesn't actually end up hurting us.
So I think a couple things. One, there's a lot to be aware of and to unpack. In the CARES Act, and particularly, I think on the hey son, on the tribal side, one of the most important things is, the tribes basically got screwed. The tribes really got screwed in terms of how much money they got on a per capita basis. And then, there was also a lawsuit where you had the Alaska Native Corps, not the Alaska Native tribes, but the Alaska Native Corps wanting to go after that money as well. And that put a lot of division. And I think that's going to create a big rift that's going to have to try to be healed over the next years between tribes and kind of our brothers and sisters up in Alaska. Organizations like ours, we said, let's lean into this, and we dropped $10,000 on an attorney to help us walk through everything. And so that would be the first thing I'd advise a tribe is lawyer up to help you walk through that. And there's also an incredible amount of lobbying that had to be done in terms of how that money was allocated. Because there was a lot of consultations and a lot of back and forth, and every tribe is different. So every tribe is going to wanted to create a formula that would be advantageous to their tribe, whether it be a large land base, lots of employees, lots of tribal members, etc. So those were like definitely a lot of considerations that need to be in place. And I think for organizations like TFA, it's going to be really, really important that organizations that talk about equity and wanting to be about social equity actually step up and start helping the communities that they, say that they're wanting to serve. And we're going to have a massive $3 trillion stimulus. I'm predicting that we'll keep the House. I'm predicting we'll take the Democrats will take the presidency, and there may be even a shot at taking the Senate. If that happens, $3 trillion stimulus package is going to be the bottom. And what we don't want is for poor communities, communities of color, communities in poverty, to continue to miss out on that opportunity to invest in their communities, because that's just kind of typically how it goes. So we're going to need everyone to be on board pushing for equity.
Yeah, I would agree with Weezy that definitely the funding formula wasn't favorable to especially tribes in South Dakota. And so that would lead to, right now, the census numbers were about 1% of filling out that information. And so as it is, we're grossly undercounted, and it being a census year, we actually are risking losing population numbers, which would be tied to all this, and specifically for our tribes with these types of funding formulas. So that's definitely hurt us. As far as funding, CARES funding for Pine Ridge Indian Reservation, they had to, each district created its own plan and then has been documenting everything. And so identifying what eligible expenses were was a bit of a struggle. And as Weezy said, that we only got a portion of the money that we were even granted. So just having the funds come in at a very slow pace, what was challenging, as well as a lot of ambiguity of what is eligible and what wasn't, as far as even like nuanced details of what type of housing units we could have for the isolation. The other question, and maybe not to put Charles on the spot, but the state of South Dakota is allocating about $68 million towards education in 3 different buckets. And so one of them is through technology and then assistance for students to make sure that, to try to alleviate some of those inadequacies, those inequities. So I don't know if those funds are being, like, anecdotally, how are they being applied, and are reservation schools receiving those funds in a meaningful way, or because as a state official, just making sure that the tribes aren't left out of any state funds outside of reservation funds that we're eligible for.
Sure. Could what I would comment in terms of the CARES Act and just kind of how it has affected VIE tribal grant schools is, number one, there was really 2 allocations of funding. I want to say about $45 million filtered through VIE. And then there was another $150 million that filtered through US Ed to Indian Affairs to VIE. And so we got the allocation based on ISEP funding for the initial allocation of the $45, $42 million. The other question, and this was one of those, I think Weezy mentioned the thing about the lobbying and the infrastructure of the Alaskan corporations lobbying for funding. I think with that CARES funding from the U.S. Department of Ed, there was really a breakdown of, 40% was going to tribal grant schools and another 40% was going to tribal grant colleges. And that argument within that consultation to me was, I hate being in consultation when you start, fighting amongst other tribal entities for not enough resources. But what the general argument of the tribal grant schools is per pupil, how is the Department of Ed classifying tribal grant colleges? Are they classifying it as every tribal student in college, or are they classifying it as actual tribal colleges on federally recognized reservations? And those are two different classifications. But the way that broke down, our argument to tribal grant schools is tribal grant colleges are going to get a much higher level of funding per pupil. And our argument as a K through 12 system is that we, at the secondary, at the higher education level, they're much more capable of moving to an online platform, where a K through 12 system needs additional resources to get to that level. Red Dawn, back to your question in terms of our relationship with the state of South Dakota and when it's actually allocation of resources. I would love to have that conversation. I know I've had it with Mr. Fluke. I've had it with Governor Nome, but I've yet to see the state of South Dakota ever really give tribal grant schools any additional resources. They generally fall back. I would guess their argument would be, oh, you guys received your money from the Department of Ed. This money here is for the state of South Dakota. If we gave you some, it would be double dipping. I don't know if that's the correct scenario, but I almost feel that would be the state of South Dakota's response. But I'm willing to ask with you.
Well, great. Well, so these numbers that we have from NOME haven't actually been broken out for where those allocations are, other than the large 3 buckets, with it being the K through 12 schools, higher education about $19 million, and then the rest for cleaning about $44 million. So, but within those buckets, we don't see where they've gone yet because that hasn't gone through the Legislative Appropriations Committee. So I don't have those numbers, but I'll definitely be asking, and so will my colleague, Senator Troy Heiner. That's definitely something high on his priority.
Our next question from our council is for Andy, but if we have time, I would love to hear from more panelists regarding this because it's an issue that affects all areas of Indian country. But our question is, what action steps are being taken for people whose voices are unrepresented? There's a great invisibility for those relatives who don't have access to water, food, life necessities, and essentials. So our question is, and I'm sorry, my neighbor's mowing. I hope you can still hear me. What action steps are being taken to serve these extensions of your community?
So, when we first got into the conversation of COVID, there are some good and bad to anything we discuss with this. And one of the areas that I feel is a good part of it is that our president is, and many of our elected officials are realizing the impact that it has on many of our tribal members, especially those who come from very isolated rural areas, and their lack of water. And currently the Navajo Nation does cite that 40% of its population do not have access to running water or electricity. And that's a very large number when you're considering over the 175,000 individuals who reside within the Navajo Nation. And so I'm not exactly sure what the president's administration is conducting in terms of those who don't have a voice or those who feel like they're left out of the conversation. However, the Navajo Nation president has been very transparent in getting his next action steps, his next, calls or anything that he's doing to receive community input. And a lot of this is then conducted through email. So he'll share all of that to many of us. And so we just provide our recommendations or our concerns. So he's been visiting communities almost every day, and he spends with these communities. And so many of them will be able to have access to get whatever their concerns are to him. And I know, the Navajo Nation is projected to receive about $600 million in CARES Act funding. And many of this, of course, is going to be earmarked for water. It's going to be earmarked for electricity, for other formulas that require healthcare or education or public safety for many of our students and communities. And so he's been very open on hearing what the people have to say in terms of also what the tribal council, the Navajo Nation is comprised of 24 tribal members who are council. So they've been very transparent with their audience. And it seems that, there are some individuals, of course, who will have certain things to say, but all in all, President Ned has been very open into receiving feedback from our communities.
Hi, my name is Shante. I have a question for Charles. You covered some of the social issues that our youth and our families are facing at home now during this time. And a lot of them may be facing traumatic experiences. And we're kind of wondering, what are you thinking for an aftermath of COVID-19? And are there any plans in place for when students and staff are returning back to work and to school? So not only just the plans for learning overall, but like even mental health issues or anything that people and families are experiencing during this time. Do you have any plans set in place to support those people when they all return back to the norm?
We're fortunate enough that, and I don't think we have all the answers, but we're moving into year 3 of a SAMHSA Project Aware grant. And so that's really based on resources. It's a partnership with Little Wound, Crazy Horse, and American Horse School. So we have a counseling staff at Little Wound of probably 8 additional health and wellness counselors. So they have a program, a multifaceted program for, number one, being able to deal with kids in crisis, being able to, really service the students there. But they've also, within our school, they're such a young, energetic group of young people that they're able to connect with students at a higher level. They've had little different group sessions online. They've made themselves available to students through technology. They're operational 12 months out of the year. The other side of it is, I know we've offered some kind of online talking circles for our staff members. I overheard a couple meetings. I was really surprised just how much, I think everybody has a little bit of stress and trauma going on in their life. And I think moving forward, we're fortunate enough to have those resources in place. We'll utilize them the best way we can. I know we've worked through different rationales, because one strategy of really bridging the technology gap is, conversations with SAMHSA, tapping into, online counseling programs for students. If we could tap into those same type of resources, we might be able to address the access to devices. There's some infrastructure networking on our reservation that if the tribe took some action, it would really open up Wi-Fi access, some FCC policies that they're moving, but after COVID-19, I wish they would get expedited, because the reality is, if those policies were were put into action and we could light up some of the districts with Wi-Fi access, ultimately it would save the schools bottom line operating budgets. It's just hard to get to those points. But I think that access to technology opens up access to telehealth. And that gives those students and families that individual connection to meet with certified counselors. So we definitely have some plans in order. We definitely have some resources moving forward, but there could still be some more capacity built with different federal agencies within our reservation.
I think one note I'd make is, everyone's kind of talks about, how great it's going to be to get back to normal, and kind of one of the things I'm saying is, I'm not really excited to get back to pre-COVID normal, because it really wasn't working for us. When you look at rates of poverty and educational attainment rates and life expectancy and poor health conditions, that's definitely a normal that I don't want to go back to. And I think that this is, like, on the positive side, this is an opportunity for us to grasp the moment and say, hey, let's change this. Let's create a new normal. Let's really focus on what's most important to us. Is it children? Is it education? Is it language? Is it culture? Is it taking care of our land? Whatever that may be. That's kind of what the social distancing does, and the isolation allows you to really figure out what's most important, and a lot of times that's people and family, because you're isolated and you miss people, and it's difficult for a lot of folks. So this is going to go on for a while. That's what the experts are telling us. We're probably going to have, we might go back to school in the fall, and we'll probably go on lockdown again when things get really bad in November. We're looking at 200,000 deaths in the United States. We're lucky if it's 18 months for a full vaccine. So it's going to go on for a while. And this is that time to really lean into it. And I would mention one more thing, and I'll be quiet, is this is definitely not the first time that Native communities have gone through this and experienced this. This happened, much more devastatingly when first contact with smallpox and other diseases, that wiped out 90 to 100% of Native populations, depending on where you were at. And, we had the 1918 flu epidemic that just decimated Native populations. So I think right now we're kind of lucky in terms of its impact compared to historically, but this is when we look back and lean on our values and our perseverance and accomplishments of our ancestors to say, okay, let's use this as a transition moment and a wake-up call to get better.
Thank you for saying that. I think personally, I really agree with everything you're saying, and I think that's something I've been thinking about as well. Is like, I don't think any of us really want to go back to the normal before COVID, and it's really important that all of us think of ways of how we can move our people more towards liberation and away from where we were. And I think that's a good point. So thank you for bringing that up.
Hi everyone. Go right ahead.
Oh, no, I was just going to follow up on one of the things that Weezy said, is that, and as educators to keep in mind, people talk about the spike when it peaks. And I think that South Dakota has said that they've reached their peak kind of like statistically in May. We may reach another peak for reservations. I think that we're heading towards that. But outside of that peak is the tail. It's going to be pretty long for our communities. What we didn't mention, what I didn't mention, which is actually probably the community that's been hit the hardest, is our urban community. In Rapid City, we have 100 active cases, and there it's very, very visible that we're not just dealing with COVID in itself, but we're dealing with the inequities, COVID, and then levels of like homelessness, mobility, that people come back and forth to the reservation, and then underlying addiction. And I would say right now, what's complicating the spread or the containment of COVID is high rates among the homeless population of addiction. And so that's been a struggle. And CEO of Great Plains Tribal Chairman's Health Association, Geraldine Church, has done an amazing job of really trying to combat that, but it's pretty huge. And I think that eventually we're going to start feeling that impact on the reservations, and our children will feel that those same types of impacts of overcrowdedness, trying to go to school. I have a son who he's already finishing college soon. So I guess I was lucky in the respect that I didn't have to have this quick transition to online learning. But I will say, just because of the difficulties of being the responsibilities and everything, I don't know as a parent if my child when he was young could have transitioned very easily, nor would I probably wanted to. I think I probably would have just been, I don't know. So just, I think that the kids that you're working with will definitely be dealing with a lot more things than we're aware of. So just something to keep in mind, and it's going to last for quite a long time.
Thank you so much. That actually transitions us right to my next question. So my name's Lindsay Early, and I was a core member in Lawton, Oklahoma, my home community. And now I'm with the National Indian Child Welfare Association. So my question is two-part. I'm curious to know what your communities are doing in support of child welfare workers, if they're still able to support parents with what they're needing, and then is there additional support or funding for mental health regarding the COVID-19 pandemic?
Well, I could speak to South Dakota as a whole, because that's one of the things that we've been really concerned with. There's a large number of our Native children in the foster care system right now. And so what we've seen through this process is a lot of families saying, we can't, one, afford to keep the foster children that we have, or two, maintain that structure, because a lot of the parents have, we're used to sending their children off, the foster children off to school. So now that they're having them full time, 100% of the time, that adds added expense, stress, all of these other layers that they haven't dealt with before. So there has been a large number of calls of parents in the foster care system saying that we need to find either more support, or I can no longer be a foster care parent. So, and I'm not sure what that looks like on the reservation, but I know just off reservation, it's been pretty high, and it's something that we as a committee within the legislature is trying to address and make sure that funding sources go that direction, and that they're getting the support that they need.
Thank you so much.
I think from a tribal grant school perspective, in terms of our interaction with Child Protective Service, you know, I guess my assessment is the schools on our reservation tend to be, you know, we moved to becoming a trauma-informed school. We've changed, you know, offered different levels of training for our students. And so what that's done is kind of created safe places for our students where they will go to a staff member and express some of the things that are happening at home. So I think that's probably one element that I can't speak to Child Protective Service, the tribal system. I know they have some challenges, but I also think that a lot of times that the school serves as the safe place that the kid actually has an outlet, that there's a counselor, there's a teacher, there's someone that's actually going to listen to them. And then the other side is we have policies and protocols when abuse or neglect take place, and those kids, you know, there's the report and that ramification of how it plays out in the tribal system. So I would, you know, think there's probably some levels of abuse that just aren't being reported at the same level as when schools are in standard operating procedures.
Thank you all so much. I'll turn it over to Wazi Hanska for our last question of the evening.
Actually, Ashley's gonna take that one.
Thank you.
Good evening, Charles, Red Dawn, Wizipan, and Andy. Thank you so much for joining us. We're really happy that you were able to take some time out of your evening to attend this important conversation. So the last question I have is, what steps are you taking for yourself and your family in terms of self-care, and what advice do you have for others? So we'll go ahead and start with Red Dawn.
So for me, I'm Oglala Lakota and Navajo and Dene. So one of the things when this hit early on, my father and my brother live in Navajo Nation. So just, I think that putting a lot of focus to make sure that my immediate family there had a plan in place, and that knowing that we work together to have that plan, and, you know, understanding that there's a lot of privilege that comes with being able to make sure that my dad, who's 72 years old, was safe, and that we had a system for groceries and just everything there. It alleviated a lot of my stress. And I, and probably everyone else, has been extremely busy. I think that I have back-to-back Zoom calls, so just kind of that process. And I was fortunate enough to work with a nonprofit that put a lot of time and focus into getting funds for PPE regionally for the Indian Health Services. And I think that was really helpful for me to know that this stuff's going on, and I could actually be an active participant in trying to raise the funds, make sure that our frontline healthcare workers had the appropriate PPE. And so just spending a lot of that time and energy of being able to be helpful around COVID, or as helpful as I could be, I think alleviated a lot of stress. And then the other thing is, I've definitely been doing a lot more yoga than usual, which I have more time, which is great, but just mainly making sure that we have plans in place, that my family my immediate family is safe, as well as doing the work that I can to help our community on a much, much larger scale. And then again, yoga and, EP and prayer. So it's been helping me.
Excellent tips. So prayer, yoga, being helpful, those are definitely important. I'm going to go ahead and thank you so much, Red Dawn. Pass the question over to Andy. Andy, if you need me to repeat it, I'm definitely happy to do so.
Yeah, can you repeat it in Navajo? Just kidding.
Hold up.
No, just kidding. Yeah, so since March 13th, when the first executive order, stay-at-home order, was initiated on the Navajo Nation, I stayed home. I do live in a beautiful, isolated community from one of our near larger communities, but also have the conveniency to just go if I need to get like groceries or anything. I boycotted a lot of our border towns simply because of the rise in cases there. I know a lot of us Native people love Walmart, but I haven't been to Walmart in like 2 months, so which is a good thing. So I've been doing that as well. I've been working from home. I have very good internet. I'm able to dish out a lot of things that I'm expected to with my job. So that's a plus. I'm also very cognizant and cautious of the people that I'm around. I do have older aunts that are around me. I do have nieces and nephews and my mother. So I've been also teaching them and educating them on what COVID is, because with many of our elders, it's not simple to tell them, you know, that the sickness is here and what it's causing, and the translation that we have for COVID-19. I'm not sure exactly who coined the term, but it resembles pneumonia. So I think that's part of one of the reasons our elders are they don't kind of believe what is happening, probably because they're a lot more physically fit, smarter than a lot of us now. But, you know, that's just something that I've been teaching my family. Myself as well, just going back to what Red Dawn had mentioned, there are certain prayers, there are certain medicines that you will not find at Walmart, you know, that we rely on. There's, you know, the horse meat that the Navajos are told is very good medicine. So these are the things that I've turned to and that I've always turned to for many years, but, you know, being very cautious of what COVID can do and not really knowing what it can do as well, because we all have different bodies. So that's just something that I've been doing every day. I know the first few weeks were very tough for me, simply because I'm not used to just being home. I'm used to, you know, being on the ball. And so that's just something that slowed down. But I also took the time to look at the severity of COVID and really, you know, bring my family together to understand it. And the advice I would tell people is that you don't know the risks that you have or that you're giving to others, and that whatever you decide, whatever choices that you make can be detrimental to not just another person, but that person's spirit, their language, and the other important things that they carry for their own family. So, you know, we may find a luxury in going to one of our near border towns, or, you know, going to the beach or whatever, but we don't know if we're carrying a case, and we might pass it on to somebody who relies on just that one person in their family. And again, just going back to the language, that's just one of the huge things that's just heartbreaking for me, is to see the number of folks on social media who are our elders and identifying those teachings that you know, that could have been passed down to many of us. And so just know that, you know, don't be selfish when you go out and about. Take precautions. It's very common sense. It's not something that is not difficult to comprehend. So with that, I also forgot to mention earlier when I first answered the question that, you know, my discussion and my contribution to this roundtable conversation is really from my experiences and, you know, the things that I've learned over the past few months. It's not like everything I'm saying is the official word from the Navajo Nation. I've just been very fortunate to live here, enjoy it, but also see firsthand what is occurring here on the Navajo Nation, and working closely with some of the administrators from the President's office. And I did devote some time to our COVID-19 command center. So that's just basically where a lot of my insight and contribution this evening has come from. So thank you for your question, Ashley. It's good to see you.
Thank you, Andy.
Thank you so much, everyone. I wanted to briefly just open up to the audience if there were any questions, both either in the chat or to come off of mute, that you would just like the panelists to offer. And panelists, if you have any last thoughts you would like to leave us with, we welcome them and we thank you. And Wazihanska will close us after.
It's so quiet. I feel like I asked a question in my former class.
Well, we'll go ahead. Thank you, everybody, for joining the call tonight. Thank you to the panelists for your incredible insights and perspectives. We'll go ahead and close out a little bit early, give you some time back for your family and meals if you're getting ready to eat or whatever. But if it's okay, I'd like to say, offer up a closing prayer just to thank the Creator for this opportunity that we had tonight here, and just for this information, and just really express, you know, encouragement for all of us to stay, you know, vigilant and strong for our communities and for our families. And with that, Tunkashla, we're thankful for this opportunity to be here, Tunkashla. We're thankful for the opportunity to hear from our panelists. We're thankful for their knowledge, for their perspective, and for sharing